In just about 2 hours, President Trump will take part in a Make America Healthy Again event in what appears to be an attempt to turn attention away from Iran and back to domestic issues as we look to the midterms. Part of that, a podcast Health Secretary Robert F. Kennedy Jr. is launching. It's titled The Secretary Kennedy Podcast. He says it's to usher in a new era of radical transparency in government.
I'm going to ask the questions and lift the taboos and expose the hypocrisy and the conflicts and the corruption. We're going to follow the evidence wherever it leads. And we're going to name the names of the forces that obstruct the path to public health. This isn't going to be about politics. It's about our families, it's about our children, and it's about confronting the spiritual malaise and embracing the truth. If we want a healthy nation, we have to confront the lies that have made us spiritually, morally, and physically sick.
Cornell Belcher is a Democratic strategist and an MS Now political analyst. Joining me here in studio is Jonathan Capehart, Pulitzer Prize-winning journalist and co-host of MS Now's The Weekend. So many things, just even looking at your face, that I could ask you about. But let me start with this. Why is the leader of what's supposed to be a science-based department of the United States government talking about spiritual malaise and what has made us spiritually, morally, and physically, I think the word was corrupt or...
whatever. It doesn't matter what he says. But the first thing I wrote...
Sick, sorry.
Yes. So the first thing I wrote down is, great, Secretary Kennedy, but how about you actually run the department where you're the secretary? No, I don't want to hear a podcast from the Secretary of Health and Human Services. I would like to know what he's going to do about the measles outbreaks all over the country. I'd like to know what he's going to do, about a whole host of health challenges.
Jonathan, he's going to lift taboos and expose the hypocrisy and the conflicts and the corruption.
Right. And, we did this last night on The Last Word at the very end. And it ended with me saying, great, we're going to take advice from a guy who said this, and we went back to him being on a podcast where he talked about how back in the way back, he used to snort cocaine off of toilet seats. This is the guy who is running the Department of Health and Human Services, but also is the guy who is now going to, quote unquote, expose the lies that have led to a spiritual and moral sickness in the country. As my grandmother might say, child, please.
Cornell, I love that. Child, please. There are plenty of elements, frankly, of the MAHA movement that a lot of America agrees with. We should be eating healthier. We should be moving more. Walking, running, whatever, lifting weights, removing chemicals from food, limiting screen time. So there is a winning message in there somewhere. Is this podcast going to get that out?
Well, the idea that there's a winning message there somewhere is problematic to me because it's politicizing a space that we don't want politicized. And this whole ideal that make America healthy again, if America is not healthy right now, it's because of the actions of the secretary, right? To Capehart's point, look, we have outbreaks of diseases that right now in this country that we thought we had cured and gotten rid of. Right, we had more outbreaks of measles last year in this country than we've seen in 34 years. 34 years. So if we're not as healthy, it's because of that. It's because of the incompetence that we see here and his dismantling of the infrastructure of the health infrastructure in this country. You have members of the AMA, right, who again not partisan, just medical professionals who've been quite vocal about how this person is perhaps a danger to the health of Americans. So I don't think we need a podcast. We need serious people in these positions doing the serious work of the job and not them going out on the campaign trail, right? This is about Americans and their health. Lord help us if we have another serious disease outbreak in this country like COVID.
Yeah, Politico is reporting that RFK is going to do a campaign blitz, Jonathan. He'll, quote, appear alongside Republican House and Senate lawmakers in states with some of the most competitive House and Senate races this fall. Why send one of the cabinet's most divisive members on the campaign trail?
Well,
Money? Fundraising?
Maybe fundraising, but Chris, I would argue that you are asking your question from Earth One. And I would argue that the mindset that would say Secretary RFK Jr. would be great to have on the campaign trail is thinking from Earth 2. Folks who are in this bubble where they don't seem to understand that the country is fearful. The country is suffering from anxiety, and the country would love to know what its leaders are doing to solve things like affordability. Or how about, again, the measles outbreak that's been happening, I think in South Carolina and other states?
Or how about health care coverage?
Or health care coverage. As someone pointed out the other day, I think it was Congressman Boyle, again, last night on the last word, where he said, when they were fighting over expansion of the Obamacare subsidies, it cost half of what has already been spent for the war in Iran.
Cornel, so where does this leave the American people? Or where does it leave, frankly, even Republicans? Does he have political firepower to mobilize voters, again, given controversial views on things like vaccine skepticism?
No, it's an odd thing, and I've got to use Capehart's Earth 2 reference because, look, if Republicans want to put him out there on the trail and make health care and what this administration has done with health care a major focal point for the midterm elections, I think every Democrat in a swing district would welcome that with open arms because it's clearly an issue that's breaking very hard against Republicans right now, and Democrats have a lot of target-rich opportunities to take them on healthcare. So if they want to make the healthcare the central part of their midterm push, I think most Democrats would welcome it with open arms.
Cornel Belcher, Jonathan Capehart, thank you.